For this video, we are going to demonstrate how to prime and hang a secondary IV for your Alaris IV pump. First, you want to gather your equipment. You want to gather your medication, your tubing, and of course, be next to your pump that you're going to hang it with. So you're going to, again, check to make sure your medication is the correct medication. You are going to check the expiration date to make sure that you have medication that has not expired. You want to check the consistency and color of your solution. For our purposes, this should be clear and not cloudy. You're going to look at your supplies, making sure you have your secondary set and that it works with your Alaris IV pump. And check the expiration date. It's hard to see on there, but it is imprinted on here that your set has not expired. You're going to open up your set. Within your set, there's going to be two pieces that you're going to use. One of them is your IV hanger. You're going to open that up, and this is what your primary IV bag is going to hang from when you're ready. And then you have your secondary IV tubing. It is shorter and it does not have the medication ports as your primary IV set does. I want to make sure that I put my roller clamp on so I do not lose any of my medications. I'm ready with my IV tubing. I'm going to prepare my medication. Some of the medications have a foil that you'll peel to get to the IV tubing spike hole. Some of them have labels that you'll peel off. Some will have a little medication bottle, so it just depends on the medication you're hanging. For this purpose, we're just going to use the foil tab that we pull off. I'm going to take my secondary tubing without contaminating either port. I'm going to take off my protective cap and I'm going to insert it. Again, making sure that you do not contaminate your set. Once it's been inserted completely, you can go ahead and hang this set from your IV pole. So I've prepared that. I'm going to hang my primary from my hanger. So the system works on gravity. So the big bag needs to be lower than the smaller bag so that this medication infuses rather than this medication. So I'm going to go ahead and prime my tubing. Again, I want to do it slowly because I don't want to lose any medication. So I'm going to go ahead and squeeze my drip chamber so that it is halfway to 2/3 full. And then I'm going to slowly release my roller clamp. Again, I don't want it to go too fast because the air bubbles will collect and I possibly could lose medication. So you can see my medication is going down. If it gets stuck at the roller clamp, you can loosen it up a little bit. There it goes. And it is at the end of it. I'm going to go ahead and clamp my roller clamp so I do not lose any medication. I'm going to have my alcohol swab. And I'm going to look for my first medication port, which will actually be before your IV pump. So this is the medication port. And I want to make sure I'm swabbing the medication port for 15 seconds. And they actually recommend that when you're doing it that you actually push and give a little pressure so that you're cleansing the inside of that medication port. So you'll actually feel it pushing a little bit. So once I've cleansed it for my 15 seconds, then I can go ahead and take my protective cap off of my secondary tubing, and again without contaminating it. Then I'm going to connect it to the port that I just cleansed, and you actually have to line it up, and then you do have to push. It takes a little bit of pushing. You can see there's a little bit of spring there. You have to push, and then you're going to twist your cap. So now I have a connected secondary tubing to my primary bag. So I want to set my IV pump up to run. So how to do that is you're going to select your channel first. You're going to select the button that says secondary, and then you're going to find your medication. So for our purposes, I'm going to hit my alphabet. I'm going to hit C. I have cefazolin, so I'm going to select cefazolin. The pharmacy has pre-programmed normal doses that you would give for this, so I'm going to find the dose based on the physician's order. So 1 gram in a 50 ml bag. I'm going to select that. It's going to ask me, do you want 1 gram and 50 mLs? Is this correct? So I'm going to hit yes. And then it's going to say, again, confirm this. The pharmacy, again, has it pre-programmed, so they have already calculated that 1 gram and your 50 mLs is going to take so long for it to infuse. So I'm going to hit, it says press next to confirm. Next. It's going to say verify secondary clamp is open, and then press start. So again, I want to make sure this is correct. It's telling me that it's going to run in 30 minutes. Everything is correct. Then I am able to open my roller clamp, and I'm going to select start. Once I've selected start, it's going to tell me the rate is going to be the rate for my medication, and then it also is going to display that I have 1 gram for my secondary running, and that it is cefazolin. So it'll tell you the medication that you have put in, so you want to ensure that that is correct. And the last thing I do before I walk out of the room or leave, I want to make sure again that this medication is dripping, and so that once I've confirmed that, then I know that medication is infusing properly. There has been times where the medication, maybe you forgot to unroll this, and the IV pump doesn't know that this isn't unrolled, so it'll just take the fluid from here versus giving you the medication. So you don't want that to be a medication error, so you want to ensure again that that's dripping properly. Once the medication has infused completely, after your time that it specifies, the pump will beep to let you know that your set has been completed, and that it automatically will switch back to your primary rate. Once you've have completely infused this, you can leave this connected to your IV fluids. It is good if you leave it connected for 96 hours. If you have to disconnect your secondary tubing from your primary tubing at any time, then this set is only good for 24 hours. So to discontinue or disconnect this set, you're going to put your roller clamp on, and then you're going to disconnect this. But before I do that, I want to make sure that I have this red protective cap. This red protective cap is going to prevent contamination of your secondary tubing so that you can use it again. So I've roller clamped it so I don't make a mess on the floor. I'm going to untwist, and then you do have to kind of twist it a little bit for it to come off. I don't have to worry about touching this part. This is the piece that I don't want to touch. So I'm going to have my protective cap. I'm going to go ahead and open that. And then I'm going to put this over the end so that I know that this is not going to be contaminated, so I can use it again at a later time.